Hello. Today I'm going to be discussing a patient that I encountered this past week during my clinical rotations. That was kind of interesting. So the patient that I had was a 68-year-old male with a past medical history that was significant for hypertension, BPH, hyperlipidemia, and neurological decompression sickness from scuba diving in 1999, who presented to the ER with a chief complaint of loss of consciousness. He stated that he was getting ready to watch the Cowboys game when he suddenly lost time, he said, and he was suddenly on the floor when he woke up. He reported that he had some urinary incontinence, and when he woke up, he felt like he did LSD. So he did not know exactly how much time he had lost or how long he was down, but he thinks that he was only down for a few minutes. He denied any recent head injuries or falls. He did note that he had been having some difficulty with ambulation for the past few years, reporting some issues with balance, but he stated that he has, quote, inner ear problems. He denied any headache, dizziness, any abnormal visual changes, chest pain, shortness of breath, palpitations, no abdominal pain or urinary symptoms, no diarrhea, no numbness, no tingling or weakness in his upper or lower extremities. He did recently travel to Mexico in a private jet to go scuba diving. He said he's been doing this for many years. He reported having done 18 dives down to approximately 100 feet this past trip. So he reported to having been diagnosed with the neurological decompression sickness that I had mentioned back in 1999, for which he said he suffered from neurological deficits. The patient stated that it affected his spine, but didn't really give any other details with that. He denied any recent sick contacts. He had no fevers, no chills. His appetite has been fine. He has never had this loss of consciousness before. He called his primary care physician and he was advised to come to the emergency department, so he came to our ER. CT scan of his head without contrast showed a pronounced enlargement of the ventricular system. So he was consulted by neurology was consulted in the ED, and he was admitted for further workup and started on some Keppra. So the main differential diagnoses for this patient were, of course, syncope and seizure. On physical exam the next morning when I saw him, he denied any dizziness, no lightheadedness, no gait issues at the time. He had full strength in all of his extremities, and he said he felt fine. He denied any vision changes or any seizure-like symptoms. His vital signs were blood pressure of 130/81, pulse of 64, respiratory rate of 16, a temperature of 98.3, and his SpO2 was 95% on room air. His labs were all within normal limits, except for he had some low potassium at 3.5. His UA and UDS were negative, and his TSH level was also normal. His syncope workup that we ordered included orthostatic vital signs, which did not show any orthostasis, carotid ultrasounds, which were negative, and a 2D echo, which was also a normal echo, showed some EF of like 60-something%. His seizure workup that we also included, since seizure was one of the differential diagnoses, was we included an MRI without contrast and an EEG. Like I said, his workup for syncope all came back negative, and his EEG showed no seizure activity at the time. But of course, it was only a spot check EEG, so not the greatest. It's only going to capture if you're actually having a seizure, which shorter exam, you're not going to necessarily capture that. But his MRI still only showed a chronic ventriculomegaly and chronic small vessel ischemic changes. The patient did not have any more of these episodes of losing his consciousness, and it was determined that given his presentation, particularly that he had the urinary incontinence, that he most likely had a seizure. He was discharged with a prescription for Keppra and instructions that per Texas law he was not allowed to drive for 3 months, and that he should also not scuba dive for at least 3 months. So what I found to be the most interesting about this patient was really that he had this hobby of scuba diving and that he had a history of the neurological decompression sickness or the bends. I'd never met a patient who actually has had that before. Of course, only just learned about it in books. So, I couldn't help but wonder if this past diagnosis, plus the fact that he had recently come back from a diving trip, could somehow be related to his new onset of seizures, since there did not seem to be any clear etiology for his seizure. So according to a study that I found by Todnam and Veronese, it included interviews of 40 divers, and they followed them 1 to 7 years after their last deep dive. And 2 of them were found to have suffered from seizures, and 1 was found to have shown some cerebral ischemia. So I thought that was kind of interesting. In addition, a study that I found from Stossner and his associates that was done in 2019 showed that small vessel ischemia can manifest as epileptic seizures and TIAs. So this particular patient did show microvascular ischemic changes on both his CT and MRI. So I was wondering if this could be contributed to his diving hobby. Perhaps, him doing all this deep diving for so many years was causing like these small microvascular ischemic changes in his brain over the years. Now, of course, it can also be argued that given his age, this could just be a normal part of aging. Plus, he also has a history of hypertension and hyperlipidemia, which also put you at risk of these microvascular ischemic changes in your brain. So it is totally plausible that it could have nothing to do with the diving at all. But I did find this to just be really interesting, since we really had no clear etiology for the causes of his seizures, and that, perhaps his microvascular changes could be a result from all his years of deep sea diving. Whatever the etiology may be, I think it's very important to note that scuba diving could potentially put a patient at risk for having seizures, especially in the setting of an acute neurological decompression sickness that can also manifest as seizures. So, definitely something you want to keep in mind if you happen to have a patient that's an avid scuba diver who is suddenly having seizures. You definitely want to be ruling out this decompression sickness, or, the bends. And of course, keeping in mind that, in an older patient who also deep sea dives, he or she could be having these microvascular changes that could also cause seizures. So just thought it was kind of an interesting case. Never saw a patient who had these issues before from scuba diving. So hope it was thought-provoking for you and can help you to look into some more information about it. Thanks.